Commercial lipids, these are congenital invaginations of the surface mucosa at the corner of mouth. These are quite common and can be found unilaterally and even bilaterally. In diameter, they range from 1 to 2 mm and as deep as 4 mm in depth. They are lined by stratified squamous epithelium. Occasionally, minor salivary gland ducts empty into these bits, and that's the reason you can see mucus sometimes. There's no treatment required. Next is paramedian lipids. These are congenital invaginations of the vermilion that are typically found on the lower lip on either side of the midline. They vary in size, which is 3 mm in diameter and 2.5 mm in depth. When these bits seen with cleft lip or cleft palate, that is known as van der Waals syndrome. These are also seen in popliteal pterygium syndrome and orofaciodigital syndrome type 1. Next is Fordyce's granules. These are ectopic sebaceous glands located on the oral mucosa and vermilion of the lips. The buccal mucosa and the vermilion border are the most common locations, but you can also find these granules at the anterior tonsillar pillar, alveolar ridge, gingiva, palate, and even on tongue. They appear as multiple yellow maculopapular lesions, typically smaller than 2 mm. These are not of clinical importance and require no treatment. Fused to the floor of the mouth, and the frenum may be attached to the tip of the tongue, or the frenum may be too short. This disorder may produce speech difficulties, but can be surgically corrected through release of the improper attachments. It is also known as crottal or plicated tongue. A central groove is present along the midline of the dorsal surface of the tongue, with an arborization of smaller grooves from this main fissure. Patients with Melkerson-Rosenthal syndrome demonstrate fissured tongue in addition to facial edema, facial paralysis, and cheilitis granulomatosa. Fissured tongue is normally asymptomatic, but sometimes debris gets lodged within these deep grooves, and mechanical removal of this debris is required.